just repeat that. So why do you think that healthcare is a human right?
Because the government's job is to take care of people. That is the whole idea of government started a long time ago. It was that you get some people with power to help take care of the collective masses.
Why can't you take care of yourself?
Because we don't have access to the things that we need. I mean, do you want me to like get all the lab equipment to make pain medications to myself, make my prescriptions myself? I can't.
Why don't you just go to the doctor and say, well, how much do you charge? And then the doctor would say, well, what can you afford? There's also charitable organizations and hospitals.
One medical test is too expensive for an individual.
That's true, actually.
But if you re-regulated the market so that it was competitive, the cost of insurance as well as the care itself would come down.
We've had a market approach in this country for our whole existence.
Actually, it's not a market approach.
Well, right now,
all the states have increased the mandates to the point where you can't get affordable. You can't get affordable coverage because of the mandates set by the state. The state profits because they tax the health insurance, and of course now it's gotten to the point where nobody can afford health insurance. So now what they do is they say, well, now we need more of your money.
Are you glad to kind of respond to you?
Huh?
Obviously, you have a philosophy of
free markets.
No government.
No, I didn't say no government.
Free market, but the reality of the situation is that even simple test is very expensive.
The reason why it's
not because of that, but not because of government subsidies, because these tests are expensive.
No. Free markets automatically bring down the cost.
What we are is evidence-based.
Yes.
There is no such thing as a free market. There hasn't been a free market since before 2000.
Well, that's why you work to establish one.
There's no such thing as a free market. There hasn't been a free market.
To spend.
You just wanted to talk and hear your speaker.
You're trying to make statements that aren't true.
Is there a free market? Please point me.
No, there isn't.
There is no free market. So you're talking fantasy. What I'm talking about is evidence-based. Currently existing in the United States and around the world are public health solutions that are single-payer based. Medicare, for example, has been providing health care to the elderly since 1965.
And it's unsustainable.
And it's totally sustainable.
No, it isn't.
It's totally sustainable.
Every single time.
Have you looked at the math about how much we're spending right now?
I've totally looked at the math.
So you know that it can't be sustained.
No, you're wrong, actually.
The money goes back to the people. When I have two different jobs. Each one of my jobs, I pay taxes, I pay into Medicare. The money I pay into Medicare is helping the elderly right now who need it. And if that program is gone, then I will have paid in for a system that I will never benefit from.
Wait a minute. Did you know that Medicare, 30% of the cost is going towards waste and fraud? And if it were in the private sector, it would be less than 1%. Do you know
nonsense.
what? Do you know what the difference is? The difference.
Nonsense.
Excuse me. Don't interrupt me.
I'm going to interrupt you as much as I want. You're here at our event.
Let's go over here.
No, you're a libertarian flake. You're making nonsensical statements. I'm happy to interrupt you because you keep making things that make no sense.
Well, unfortunately,
there's a lot of
fraud
in the whole
and waste. When union workers can't get fired and you can't get rid of bad people because it's a monopoly, and you think that's better? My God!
We have this
and
fraud and abuse. There's fraud and abuse in the whole healthcare system.
There is no reason for government when they have no.
You are better able to control fraud and abuse when you have a single payer who can monitor it all.
That is absolute malarkey.
The malarkey is the current system.
When I can leave an insurance company because they're ripping me off, or I can leave a provider because they're a bad provider.
There's nowhere else to go.
Well, you're destroying them all.
They're all
all the regulation and all the monopoly and healthcare is destroying it.
No, what's destroying is a market-based system.
No, we don't have a market-based system.
Sure, it's market-based. We have evidence.
No, we don't. The states have mandated it.
We don't have a free market.
But you could both state your points. Don't interrupt each other. Don't say you're wrong. Say I disagree.
Well,
it's okay to disagree, but don't fight. That won't help anything.
Well, the regulation basically that is in existence right now is what unfortunately is causing the cost to go up. Did you know that they limit the amount of doctors that can go to medical school? Did you know that?
I did not know that.
And through artificial supply and demand, they're driving up the cost.
And very often.
That's AMA.
And the AMA is all for Obamacare. And you know why? Because they make money on the premium for the health insurance and the health products that they sell.
Kyra's trying to come in. Come here.
If you're arguing that the point is the regulation, presently the way it's set up, I'll agree with you.
All right.
Saying
Okay,
regulation in itself is wrong.
No. I didn't say that. Here's my point. The only point I'm trying to make. I don't think government is the best provider. What I think the reason why we hire government to be the referee, not the participant. So they can do their job and remove bad doctors and bad health insurance companies or whatever. They can punish them, but they're not to actually participate in the market because they don't have that competitive market, if you will, to eliminate them if they're bad. They can just continue to be bad. Like, that's why we have 30% of waste and fraud in Medicare.
Is the market going to allow someone that's impoverished to actually afford health care?
Well, what happens when government stops spending? Granted, we have an uptick of unemployment, right? Because all of the government workers and all the crony capitalists don't have their jobs anymore. But the thing is that the market still needs people. So within a very short period of time, probably within 18 months, based upon Calvin Coolidge and his period, you'll have those lost jobs regained. Okay, so then after that you go towards full employment. And at that point you have a lot less poor people. But because you've deregulated or devolved to the states, you now have affordable health care. You now have, and because the cost comes down, your premium comes down. So even the poor people can afford it now. So it's a cyclical process that is continually improving upon itself.
And also, I know that very often with medical supplies and medicines, they're at a 600% markup from the cost that it costs them to make them.
Right.
They are making 600% profit. And if there was a regulation that listen, let me finish. Hold on. If there was a regulation that made it so that they couldn't mark it up that much, then they could still make a profit. I have no problem with them making something and making a profit. But a 600% markup makes it nearly impossible for a lot of people to get the medications and medical supplies that they need without insurance. And if it wasn't so expensive, then people could afford it for themselves and they wouldn't need the insurance.
All right, so your solution is more regulation. My solution is cut off the money to that corporation, the taxpayer money to that corporation, and then open up or deregulate the market so other businesses can come in, and what they'll do is offer the product for less. So then all the consumers go over to that new company who's selling it for less.
They're going to offer it for less. What if they start offering it for more?
Well, then nobody would buy it.
Then what if they all offer it for more and there's no?
Well, then people won't buy it. No, but you see, I'm a businesswoman. Yes. So if I see somebody gouging, okay, it's like New Orleans. The first people that got there made a lot of money on the water, okay, a lot. And you know what? If they lived in that neighborhood, they'll probably hate it. Okay, but within a very short period of time, people were partying in their own water. So the price of water came down very, very fast.
Water shouldn't be for sale anymore.
Look, I'm into self-reliance. I'm into you having the power in your life, not the government, not a corporation. I want you to be able to determine your own future and get the health care that you think that you should have at a price that the market really could bear. So it's a lot less expensive. Under Obamacare, for kids, they increase the cost to you all. And it's like 80% increase. So I'm just saying, just think about competition has a natural way of reducing costs and improving performance. And you're here.
I agree that would be wonderful if you got rid of regulations, and because of that, the price for a few companies would go down. But I doubt that they will really do that, because I think that if you take away regulations, that people will try and do the thing that is most profitable for them, because there are too many people who care just about money and not about helping people.
In a free market, it's mutually beneficial exchange.
Yeah, I know, but I don't think they're going to want to benefit others.
If I offer a product that is, that granted, because of supply and demand, it's new.
We don't have a free market.
I understand we don't.
But
that's why we're talking about
she wants one.
Yeah.
Okay.
Yeah,
sure.
we want to strip away the regulation. We want to open up the market to competitors. We want more people involved in it, which will drive down the cost. Look,
I want you to bring down the cost, but I don't have much faith in people anymore.
Yes, but when you have latent self-interest, you understand that harming your client is a bad. And in a free market, when you harm somebody, they can walk away and never buy your product again. So believe that people will do what's in their own self-interest. And in the free market, that's a good thing. In a monopoly, it's totalitarianism. All right, thank you.